Good morning, Patrick here, coming live to you from Complete Health Eastbourne. And I just wanted to jump on and talk about something that I find really interesting, which is the way that we transfer our mechanics when a certain joint or injury occurs and how it starts to affect our other patterns or other movements. So what we know about most movement patterns is that if we lack stability or mobility in a joint, we will typically transfer that somewhere else. So I forget who actually said this, but energy can never be created, it can only be transferred. And this is genuinely a physics term. So the thing is if our body cannot generate the movement from a certain joint. So let's just say, for example, that's the hip. Our hips, from where we sit in a desk all day, or potentially we don't do enough exercise, our hips can become really, really stiff and immobile. And if that actually starts to happen, we have to try and create the movement somewhere else. And this typically will transfer to the next most available joint. Now, for most people, the joints that are surrounding the hip are either going to be the knee or the lower back. So a lot of the time, people will come into our clinic and they'll expect us as chiropractors to only check the lower back or the spine because that's what chiropractors have been renowned to do. However, we are missing a massive trick if we're not checking all of the different joints in the body, because if you miss a certain joint in the body, then all of a sudden, then you're going to start to see that transfer somewhere else. Yes, Mark, we work with disc problems all the time. And actually, this is really relevant to those kinds of things, because if we look at something like a disc injury in the lower back, typically as a rule of thumb, someone potentially has had a lack of hip movement or a lack of thoracic movement. And as a result, what you've had to do is make that movement up in your lower back. And what that essentially does is, and we know this, we all have felt this at some point in our life, because we'll have all worked in a workplace where someone's not pulling their weight, or we've played on a football team where someone's not pulling their weight, or we played on a rugby team where someone's not pulling their weight. We've done something in a team where someone doesn't pull their weight and they're not doing the job properly, and all of a sudden it makes extra work for everyone else. So if, say, for example, that hip is not moving properly, the pelvis is not moving properly, the thoracic is not moving properly, all of a sudden we can transfer that weight to the lower back and the discs start to wear. If that hip isn't moving, then potentially the knee can start to wear. Now, the knee is a little bit like a door. It only really opens and closes. So if you're opening and closing a door from the top to the bottom, what are you going to do to the hinges? You're going to tear them off. And when we look at mechanics, we try to make it far too difficult. We really need to look at some very basic concepts. Is it moving properly? And does it have the right muscle activation around those joints? Now, when we look at something like the hip, yes, we want really good mobility in the hip so that people can move in all the directions that they need, so that lower back isn't taking the brunt of the force. But at the same time, we need to have really good stability of the muscles in the hip, because if we don't and we start dropping our pelvis to the sides, we'll start to put that force through our knees, and the medial and lateral ligaments in the knees will start to take the force instead. So these principles are really, really simple, but essentially what we do in our clinic to make sure that we understand the mechanics of the whole body rather than just breaking people down into their parts is we take full posture analysis on every single patient as they come into the clinic. And the reason why we do this is that if someone's dropping their knee into the side, if they're dropping their head forward, if they're not standing upright, or they're standing twisted or leant over, it doesn't matter what it is. We can see the compensations not just at where the site of the problem is, but across the whole body. So we can then start to actually address those issues so that people can start to improve on their mechanics, so that those joints that are under stress can start to heal. Because the purpose of it actually is that we're not actually healing the tissues for you. Your body can break down scar tissue on its own. However, if there's a dysfunction or a mechanical change or a neurological change or a postural change or a positional change or an alignment change, these things can start to stress the tissues so that they start to tear. And as a result, your body is never actually allowed to heal that tissue. It's like having a paper cut. If you have a paper cut and you pull it open every single day, that paper cut is never going to heal. However, if you have a paper cut and you cover it up and you give it the right environment, then eventually that paper cut will heal properly. So look after your mechanics, make sure you're moving properly, make sure you're getting the movement in the right places, because actually some places don't need a lot of movement. We actually need a lot of stability. But that's when the professional can come in and really, really help you. Gray Cook talks about this book in his book Movement, looking at stable versus mobile joints. This is something that, again, most chiropractors are trained in at school. Most physios are trained in at school. And even my massage therapist here at Complete Health, I've started training him in the muscle and connective tissue lines so that he can start to understand how he can use these principles to help his patients as well. Guys, if you have any questions, please fire them below. Mark, great question about the disc. Yes, we can work on people that have had disc operations. We just have to tailor your care a little bit more specific to you, because obviously if there has been surgery there, then obviously we need to make sure that we're not actually going to make that worse. Now, one of the ways that we can actually test that for you is we do take on-site x-rays. So we could see that area that potentially you've had the surgery on to see whether that's something that needs addressing or whether it's something you need to go back and rediscuss with your doctor. Guys, I hope you have a lovely day. I'm sorry that the weather is not on our side. We are still here in the clinic. We are doing face-to-face visits again. So if you need any help, just give us a call and we can get stuff scheduled in for you. We also just had a new chiropractor start with us yesterday. She had a massively busy day. So we know that the clinic is going to be growing. So we've now got some extra available slots for people to get in and see chiropractors here at Complete Health, because we've had such a busy uptake since the lockdown has ended. And I can tell you why, because this conversation pretty much covers it, is that we've all been sitting at desks and we've changed that movement pattern. And as a result, it started to have an effect on our bodies. And so people are going to need a little bit of TLC to get themselves back to normal. Guys, we'll speak to you soon. If you have any questions, like I say, fire them away. You can send us an instant message. You can give us a call, or equally, you can send us an email. I'll be happy to have any conversations with anyone that needs a little bit of help or understanding to help them progress to the next level. Speak to you guys soon.